health experts are calling this a real problem.
What you're seeing is just outbreak after outbreak after outbreak.
Dr. Rebecca Sonnenschein is the medical director of the Health Observatory at ASU. She says measles is one of the deadliest diseases for children and the most contagious.
It spreads through the air in an actual airborne route, so microscopic droplets that can stay in the air 2 hours after someone leaves the room. Young children are more likely to be hospitalized with measles, more likely to get pneumonia.
Sadly, I'm only surprised that it took this long to get sustained transmission.
Will Humble with the Arizona Public Health Association says this outbreak comes as vaccination rates are dropping.
Each year we've lost about 0.5% in our childhood immunization rates. And that doesn't sound like a lot, but you'd look at over 10 years, that's 5%.
According to ADHS, 95% of the measles cases in Arizona are in unvaccinated people. Children under 18 make up 63% of those cases.
Our state has what's called a personal exemption provision with respect to childhood vaccines for entering school. So parents that don't want to vaccinate their kids can show up with this form they download from the internet that exempts their kid from the vaccines, so then that's no longer a barrier to entry into kindergarten.
With school just around the corner, Humble and Dr. Sonnenschein say without those vaccines, the classroom can soon become a breeding ground for this virus to spread.
If one child gets measles in a school setting, they're exposing everyone in that classroom.
And we know 88% of Arizonans have received their childhood vaccination for measles, but health experts say the sweet spot is 95% because of how contagious this disease is. So they say the best prevention is a vaccine. They also say you want to wash your hands and isolate if you feel sick. I'll send it back to you.